So hello everyone and welcome to Nightingale Challenge 2024 and the third EONS Early Career Nurses webinar. I'm Dr. Greg Kotronoulas. I am one of the hosts and moderators of the webinar, and together with my colleague Nanda Conceição, we wanted to welcome you to this webinar, which is going to focus on promoting cancer nurses' well-being and fostering a supportive work environment. This webinar is part of the N.U.R.T.U.R.E project. Some of you might know, hopefully most of you will know the N.U.R.T.U.R.E project, which is designed to enhance the resilience of European cancer nurses and to foster an environment of emotional support, acknowledging the unique challenges that are faced by those on the front line of cancer care. This webinar will serve as a platform to empower and enhance the resilience of the cancer nursing workforce, acknowledging the unique challenges that they face as frontline professionals in cancer care. For today, we have two excellent presentations and speakers lined up for you. Our speakers will have 20 minutes to present, and afterwards there will be a 5-minute Q&A session immediately after each presentation. So remember that there is a Q&A button option for you available to post your questions throughout the presentation as they come up. So I would like to now introduce the first speaker to you. This is Dr. Maria Irini Galanaki from the School of Nursing and Midwifery in the School of the Buckinghamshire New University in the UK, and she's going to talk to us about reflections on the career in cancer nursing and exploring self-care strategies. So welcome, Maria, and thank you very much for supporting this webinar.
Thank you very much, Greg. Let me just share my screen. Okay. So good afternoon from London. Good evening for some of you. I'm delighted to be here with you today and to take part in this Nightingale Challenge webinar. I would like to thank very much the EONS Early Career Nurse Co-Chairs, Dimitris and N.U.R.T.U.R.E, and the chairs of this webinar, Greg and Fernanda, for the invitation. And many thanks to you all for being here today. As I'm sure you know, these are the aims of today's webinar. And my topic focuses on the first two. So today we're going to explore reflections on the career in cancer nursing and explore self-care strategies. So when I was asked to speak on this topic, it instantly made me think, why have I chosen cancer nursing? And at this point, I would like to invite you to take a moment and reflect on the same question. Why have you chosen cancer nursing? I will give you 1 minute, and I would like you to just ask yourself this question. You don't have to share your thoughts, but you may wish to make a note of them. And this is just for you, really. So the time starts now. Okay, end of time. I appreciate that 1 minute may not be enough to reflect on this, but I hope this was a starting point for something you can take with you at the end of this webinar. And since I made you reflect a minute ago, I think it's only fair that I share with you thoughts from my own reflection. So the first reason that brought me close to nursing in general, and consequently to oncology nursing, was an innate instinct to help those in need and the love to care. Then when I started studying nursing, I was fortunate enough to have been taught by people who were bright role models in oncology and palliative care fields, and they have become a source of inspiration for me. As I progressed my studies and my clinical placements in cancer hospitals and departments, I realized firsthand what a privilege it is to become a close companion of a person in their challenging journey with cancer. I appreciated how important it is to become a source of support for a person who is vulnerable and who suddenly needs to learn how to live with a chronic and potentially life-threatening condition. I said to myself, this is what I want to do. So following on from my own reflection, I was then curious to see why others choose oncology nursing. I read a few blogs written by nurses from the UK and from the States, and these are a few of the reasons why. So, okay, for some people, joining the field of oncology was just pure luck. It was just a vacancy open when they wanted to apply for a nursing job. For other people, it was because of a previous personal experience with cancer. So someone from their family or someone from the very close circle had been affected by cancer or had died by cancer. And noticing from very close the compassion and the good quality of care that their loved one had received brought them closer to oncology nursing. Many nurses praised the relationships that they get to develop with patients and their important others in cancer nursing. Other people said it is humbling, it is rewarding, or our patients are so appreciative and caring for us. We have amazing patients, we have a very special group of patients. And others said oncology is pretty cool, it's an exciting specialty. And frankly, this may be the best time in history to be in this field, in the field of oncology. Groundbreaking research, revolutionizing treatments and diagnostics. People with cancer can live longer and better than ever before. It can be fascinating. And for us nurses, we are best equipped than ever to support the patients and to offer them a good quality of care and a good quality of life. We are more valued than ever before within the multidisciplinary team. We are leaders, we work autonomously, we are teachers, we have new advanced roles. Now, does this journey come without challenges? It couldn't have, could it? So what we have just described as being the strength or one of the strengths of this field can also become a challenge for some people, some nurses. It is an evolving specialty. New treatments, new guidelines are constantly emerging. So a cancer nurse really needs to be alert, needs to be up to date all the time. Then we need to face our own vulnerability and fears. As humans, we have an innate instinct to fear and avoid anything that is life-threatening, anything that brings us face to face with our own mortality. And this is fine, and we can just acknowledge and embrace this because it's just how we are made. It's like our instinct of survival, isn't it? But working in oncology, working with cancer patients, it can indeed bring us face to face with our own mortality. And some people may find this challenging, or they may find it challenging at some periods of time. Another challenge is to manage a balance between professional and personal life. Prevention of burnout and emotional fatigue, both of them, research shows that are quite prevalent in oncology nursing. Staff shortages, which is something that concerns nursing globally, but also it is specific to oncology nursing. And the next challenge, it applies the same for the next challenge. It can be considered globally for nursing, but also more specifically for oncology nursing, potentially hazardous work environments. So there are risks associated with working on cancer care environments. And of course, retention of expert nurses in the field of oncology. So how can we embrace and overcome challenges related to the field of oncology nursing? We're going to look at this from the working environment point of view. And also we're going to explore how each one of us can personally embrace and overcome challenges. So starting from the working environments, it is of paramount importance to maintain a safe working environment. And for this, vigilant risk assessment is required. As nurses, we constantly risk assess. We use our clinical judgment to risk assess and to make decisions every day. It is very important for working environments to adhere to legislative frameworks and evidence-based guidance. An example is the EONS Safety Manifesto. It is also equally important for nurses to feel they have the chance to raise concerns when they have them with their managers and with the rest of the team. This applies to all early career nurses and more experienced nurses. It is very important to feel that they have the space to raise concerns when they have them. Working environments should also support nurses with opportunities for continuous learning and development, because this keeps them engaged with this field, and they feel more valued and more confident. And also, they should support the team by giving opportunities for team debrief meetings, and if required, counseling. Sometimes it can be really therapeutic to have a team counseling session, especially after an event that has affected emotionally and mentally many people from the team. It is also important to provide opportunities for team learning. So, for example, team meetings with teaching for new advances in oncology and new guidelines. In that way, people can interact and learn from each other as well. And of course, to give accessibility to resources. Now, looking at it from the personal point of view, and I'm going to share with you some advice, some tips for building personal resilience and maintaining self-care. The first piece of advice is to stay connected with a wider oncology community and supportive networks, such as EONS, for example. And I have shared here the EONS Nurture Circle, and I appreciate that many of you may be already familiar with it, but it's a very good resource. Another piece of advice is to stay up to date with current evidence-based practice to ensure competence, because competence then leads to confidence in this field. Do take on opportunities for continuous learning and development. It is very, very important to recognize if you are feeling stress and take steps to manage it. Acknowledge that what you feel is normal. The first step to manage anything is to recognize it, to acknowledge it, which leads us to the next point, which is about self-awareness. Reflect on and acknowledge your own personal strengths your own fears, your biases, your areas for development. In order to ensure self-care while at work, there are some examples here, some pieces of advice. For example, to make sure you have regular breaks, make sure you keep hydrated and you're eating while you're at work. Something that is very, very important, ask for help, ask for support and supervision when you need it. Don't be afraid to acknowledge that you need help, you need support when you do. Also cultivate kindness and recognition within your team. Be a team player. Show kindness and support to your peers, to your colleagues. People do believe, and I'm also a fan of this, that an act of kindness will return to you. And ensure self-care at home. Make sure you allow time to reflect and debrief after a shift. Initially, I thought to write after a difficult shift, but then I didn't do that because I thought that it is actually very important to reflect not only on the negative, not only on those experiences that have had a negative impact, that have brought up negative emotions or has become a burden to us, but to also reflect on all our small victories, all the positive experiences we have, and we do have, and we will have while working in oncology nursing. Utilize your personal supportive network. So those important people to you that can be your support when you're not at work. At this point, it's probably worth mentioning that managing a good balance between personal life and professional life is to find that fine line, that balance on how to live work at work and make sure that you enjoy your personal life and you don't carry burdens from work to home. Sometimes it's easy said, but it's something to try and build on and to work on. Do something nice for you and try to make this regular. Make sure that you regularly do things that you enjoy. It does help your mental health, your general well-being. It makes you feel well with yourself. Try journaling. So you may try to keep a journal, and many people, many nurses, especially in oncology and palliative care, have found this very helpful. An idea is to try and write a gratitude journal. What that means for people that are not aware with the term is that every day you write down one thing that you are grateful for. This some people find a very positive experience and very helpful in order to build their own personal resilience and to maintain their well-being. Other people just try to write down, maintain a journal of their thoughts, their concerns, things that have happened during their day, and that can also be helpful. Try mindfulness, try positive thinking, focus on even the little things in every day that have been a positive part of your day. Stay active and healthy. This is also very important because we nurses, we do have a reputation of giving health advice to everyone around us, our patients, our family members, and then sometimes we do neglect ourselves. So it's very important to try and change this culture and nudge ourselves to recognize if we feel unwell and make steps to improve this, but also maintain a healthy lifestyle and stay active. And every now and then, do remind yourself why you have chosen cancer nursing. Thank you very much.
Thank you very much, Maria. That was excellent. A very nice overview and very nice tips as well. So I'm just going to have a quick look at the Q&A just to see if there are any questions. So it was interesting to hear from your experience as well. So can I just ask, was there any point in your career where you faced a challenge yourself, personal challenge, and what kind of challenge was that, if I may ask, right? And what kind of resources you used, and what kind of things you did personally to overcome that kind of challenge?
Thank you, Greg, for this question. So yes, who hasn't faced challenges during their career, and especially in this field? I think a big challenge for me has been to find balance between. It was a time in my life when I was a newly qualified nurse in the UK. I was studying at the same time. I was doing some more studying in cancer nursing, and it was challenging for me to find that balance between study, work, and personal life. I must admit that initially I did struggle because it's quite easy to not recognize that you need help and just go into a vicious cycle of trying to maintain a good quality in everything, prioritize your work, but at the same time carry on with your studies and try to maintain a healthy lifestyle and a personal life. So I did find it challenging at some point. And initially I didn't realize that I could actually reach out for support to people in my own working environment, in my personal environment. When I realized this, things changed, because I took steps I did ask for support. I realized that there is support available, and all I needed to do was to ask for support. And this was a turning point, and something that was a good lesson for me.
Yeah, I think that's a very, very important message for everyone on the webinar, and for everyone listening to your presentation at any point. And I think it's also about how you can take steps to make this sustainable as a change as well, right? So because you can try and make changes to help you right now, but what happens tomorrow? What happens a month later from now? A year from now? So it has to be reevaluated, right? I don't know if you agree.
I agree, and it's a transferable skill, isn't it? Once you go into this mentality, it becomes a strategy, and you can then utilize it the next time you will find a challenge or you will find yourself struggling. Absolutely.
And I think it's important to try and look around. I mean, I'm pretty sure there are people who are ready to provide this kind of support, but they wouldn't know unless someone says, "Look, I need some help here." So, so very important. Let me just check again if there are any questions at all. No further questions for now. So I think in the interest of time, we can carry on. We can move on to the next speaker, Fernanda.
Hi.
You get to introduce to everyone, and then we can go back to the Q&A at the end of the second presentation and check whether we have any more questions. So thank you, Fernanda.
No, thank you. Welcome to this last webinar. It was a pleasure to hear you, Maria. It was a really insightful talk. So for now, I'm going to present, I have the privilege to present the second speaker, Tugba Pelivan. Tugba is assistant professor of Israel IRL University in Turkey. She did a PhD in psychiatric nursing in 2019. She's been a cancer nurse and educator nurse for several years, and she's also an editorial board member of the magazine Seminars in Oncology Nursing. Tugba is presenting us with a complementary team to Maria. She's going to talk to us about how to enhance the delivery of high quality cancer care by developing and maintaining the resilience, but on the interdisciplinary team. Tugba will have 20 minutes also, and I remind you that you have the Q&A, and please do use the Q&A because this is an excellent opportunity for all of us to learn and to exchange experiences, which is so important. Tugba, I will give you the word and have a nice presentation. Thank you.
Thank you very much, Fernanda. Let me share my screen. Yes. Hello, everyone. Thank you very much for this kind introduction, Fernanda. And also, I also want to thank for this webinar invitation to ECN Working Group. I am happy to share my knowledge and my experience. I will start with some problems cancer nurses are facing at work, such as compassion fatigue, and I will continue with why we are talking about compassion fatigue or other problems among cancer nurses, and how we can improve our resilience. I will introduce you Compassion Fatigue Residency Program, which is an example of empowerment program. I developed it within my PhD thesis, and I implemented it several times with cancer nurses, nurse managers, or intensive care nurses. Compassion fatigue first defined by Johnson, but it was not a formal definition. She said that it is a unique form of burnout affecting caregivers. Then formal definition came from Figley. Figley explained in this sentence, you can see a compassion fatigue. As a summary, he said that stories listened from our patients are affecting us. And by the time it is being cumulative, and compassion fatigue is this cumulative stress and tension situation. And another explanation came from STEM, who has a scale related to compassion fatigue, which is professional quality of life. STEM said that there is a negative and positive aspect of our professional quality of life. And the negative one is compassion fatigue. And compassion fatigue has two dimensions, burnout and secondary traumatic stress. So we can say that compassion fatigue consists of burnout and secondary traumatic stress. We all know burnout, first Maslach defined emotional exhaustion, depersonalization, and low sense of personal accomplishment due to the seen individuals due to their job. And burnout is related to problems in the work environment, such as workload, long working hour, or communication problems, maybe with our colleagues, and is a gradual process. Secondary traumatic stress, which is another part of compassion fatigue, exposure to suffering people, dying people are affecting us, and we are experiencing our patient's process as a secondary trauma. For example, we may see our patients at our dreams. We may have flashbacks related to patients or work. It is also defined a natural byproduct of therapeutic interaction. Compassion satisfaction, which is positive aspect our professional quality of life, defined psychological reward of caring for our patients. So why we are talking about this concepts among cancer nursing? Cancer is one of the most important disease. You know, it is the second leading cause worldwide, and cancer causes many physical, psychosocial, and occupational problems for patients. And these problems are not only affecting patients and their families. It is also, all of them are also affecting healthcare team, and cancer nurses have a key role in that team in providing care for these patients. They are witnessing the patient and suffering of patients every day they go to work, dealing with intensive treatments, face maybe ethical dilemmas, are frequently exposed to death and dying patients, and they are providing long-term care and develop close relationships. So working with cancer patients naturally brings stress, and all these situations may cause nurses to experience compassion fatigue. Of course, this concept is not only seen among nurses, at all healthcare workers, physicians. You can see some percentage on this slide. There are many studies worldwide, but all of them, as a summary, are saying us cancer nurses are at risk of compassion fatigue concept. And this concept affects negatively nurses' physical and mental health, workplace performance, job satisfaction, increases nurse turnover. They may quit because they may quit their job, reduces patient care quality, and poses a risk to patient safety. So in order for cancer nurses to continue their professional lives in a long and healthy way, we need to address compassion fatigue concept. So we need to put our oxygen mask first. Also, new paradigm are saying us caregivers, us nurses actually also get hurt. Jung used a wounded healer term for caregivers. So being objective is not equal to being resilient. You can see old paradigm at the left side, but at the new paradigm, we need to accept problems. We need to take our individual responsibility. We need to improve resilience. And we know that caregiving is an evolving process and requires maturation. So at this program, the aim is to improve nurses' coping skills and increase resilience. At the first part of the program, we are trying to increase awareness of compassion fatigue. And for example, developing process of compassion fatigue, what about risk factors, symptoms, effects of stress. And at the second part, coping part, is starting with the first step, which is developing awareness of their own personal compassion fatigue story. And we are trying to increase their resilience via 5 coping skills, which I will show you next. First step, which is very important step of the prevention program, is being aware of our own personal compassion fatigue story. It is giving us a chance to look our profession and evaluate until now how this profession affects us negatively and positively. And also being self-aware enables us to help our patients more easily. It is preventing denial, actually. So you can write your personal story. You need to add negative impacts, positive impacts, and then you can share your story if you want with your colleagues at your meeting, for example. With sharing, we can see that we are not alone, actually, and also we can learn from each other experience, from other colleagues' experiences, actually. So cancer nurses need to develop resilience to overcome the situation, and increasing the resilience means less burnout and increase their ability to cope with adverse conditions. There are 2 assumptions of these skills, actually. You know, CDC is explaining illness. It is caused by the absence of effective antibodies in the body, not by a toxic environment. So we can say that our working environment is also toxic, chaotic. We are trying to reach everywhere. We are running always. But we may have burnout because of not this toxic environment. We may because of low resilience. Like the relationship between illness and immature immune system. So in this program, aim is increasing individual resilience. For this, we have 5 coping skills, and Eric Gentry, who developed this program, are calling them also antibodies, 5 antibodies. We need to use actually first 2 every time. For the remaining 3, we can use for specific problems. For example, we can use connection support for secondary traumatic stress. Let's start with self-regulation. When we perceive a threat, a problem, it can be a real problem or only a perception. But regardless of this, When we perceive threat, our brain is stimulating sympathetic nervous system. And if we still perceive this threat, sympathetic nervous system being dominant, and at that point, something going on in our body and in our brain. In our body, we may have increased heart rate, respiratory rate, catalytic enzymes are releasing, and in our brain, cortical functions are reduced. Judgment, reasoning, word production skills, even fine motor skills are being affected. So the brain and body are stimulated. With this stimulated brain and body, it is not really easy to continue our work. We may have mistake at work, or we are harming ourselves at this situation. So we need to relax our body. It is very simple. We need to take a deep breath, actually. In between 10 and 30 seconds, we may have relaxed body and increased work performance. I said it is very simple, taking a deep breath, but is it always easy? Of course, it is not always easy, because we are dealing with many things at our work, patient relatives, or trying to conduct communication network with our multidisciplinary team. So we may forget ourselves at this situation, but at a long time, it is harming us, actually. So we need to explore our stress factors. Is that real problem or perception? We need to relax our body, self-regulation. And the second one, intentionality. We need to be mindful awareness in evaluating events. Think about the problem instead of reacting directly. The 10 or 20 seconds, you need to ask yourself, is it a real problem? Because you will see, when you look at accurate eyes, you will see generally most of them are not real problem. So the second one, awareness of purpose. Focus on the goal, not the negativity. With this, being affected by negativity will reduce, and the pleasure of reaching the goal will increase. At this program, we are actually practicing writing our own mission and purpose. It is a kind of self-recognition practice. What about our mission at work, at our private life, and what about our strengths, weakness? So we are writing, discussing, and then we are sharing at this program. The third one, connection and support. We need to develop a support network, and we need to share trauma stories related to patients or related work. With this, the emotional burden of trauma stories will decrease, actually. So we need to share these stories. Fourth one, perceptual maturation. We are using this skill generally for burnout. You will remember Maslach definition for burnout. It is caused by the work environment, but in reality, this definition is not really working, because if we adopt this mentality, we need to change people, maybe work, maybe. So it is not possible, because many of them are out of our control. So Alexandre did a new definition for burnout. If requests are more, resources are less, we perceive a problem. So when we perceive the red problem, we know what is going on in our body and brain. So burnout is caused by not because of environment, because of sympathetic stimulation. So something going on in our inside, actually. So we need to relax, first of all, our body. Then we need to change our perception. We are calling them distorted, wrong thoughts. If we don't do anything, or if we think that there is nothing to do, it is a kind of learned helplessness. So we need to regulate, change our perception. What about perceptions? The way we see tasks and the way we interpret will also change the stress effects on us. So one of them, adopting a choice-making mentality. So actually, we don't have to do anything. we don't have to do anything. We are choosing something. So we need to change our perception from I have to I choose to. Notice how often you are saying loudly at your work, I have to. Then you need to change your perception. For example, if I think that or if I say that I have to go to work, then I am thinking, I am evaluating, if I don't go to work, I may be fired, so I will lose my job. Then I will not earn money, but it is, I need to earn money, so I need to continue my life. So then I am making a decision, actually. So I am choosing this. So with obligation, continue to our professional life will not be easy. With obligation actually creates stress, and at a long time we may have burnout. So we need to change our perception at work. What about our perceptions and we need to change our perception. The second one, determining realistic and accurate aims. I need to know that I am doing the best I can and that I can't afford to do more. You know, some things are out of our control. Name a situation that is out of your control, for the consequences of which you hold yourself responsible. For example, my aim, if this, I will ensure that my terminal patient recovers. Is it possible? Not. It is a wrong aim, because my patient will not recover. Then when the patient die, I will think that I can't do anything. My effort helpless, my effort was waste. Then this perception will cause burnout in a long way. So I need to change my perception in that way. Maybe because instead of this sentence, I will do my best while providing care my patients who is terminally ill. There are many things to do. Ensure good death or protect patients' dignity. So I need to regulate, again, change my perception in that way. The third one, I need to know my capacity and your limits. When you need when you need help, you need to ask for help, actually, because if you are trying to carry burden which you cannot carry at a long time, you may have burnout. You need to ask help, actually. And the fifth one, self-care skills, re-energizing our bodies. We need to develop a systematic discipline. It is our responsibility to learn, regularly practice. We need our energy is not endless, actually. You know, car's fuel is also finishing. So we need to refuel our body. We need to re-energize. And we need to explore from what we are gaining energy. It can be regular activities, healthy eating, regular social activities. We are all different people. We may like different activities, but the common thing is we all need energy. So we need to refuel our body. We need to develop and implement a comprehensive self-care plan. You can see also this program in this article, which is written by me. And I also shortly show you some studies I conducted with compassion fatigue resilience program with cancer nurses. And most of them show that the program was useful for nurses. For example, it was a qualitative study. You can see some participant statements here. Another study, again, we found compassion fatigue, burnout, and stress decreased after the program. And it was with nurse managers. The program was also useful for them. It was an interesting study because we were curious about, when we increase the nurses, cancer nurses' resilience, how it is reflecting to patients' care satisfaction. And we found that patients' care satisfaction also increased. So as a conclusion, cancer brings some biopsychosocial problems, and cancer nurses are at risk of compassion fatigue. We need to take individual responsibility and control what we can do with our own skills. I showed you with some steps. I hope it was useful for you. Thank you very much for your listening and attention.
Thank you so much, Tuba. What a wonderful presentation. I have a lot of questions to ask you. I will check the Q&A, but I suspect you have a very shy audience, so I will put my first question. So this specific program that you presented, it could be translated to all the healthcare contexts, and who can apply it? You have to have like interdisciplinary team, like psychologists and nurses, or only nurses with like mental health specialization? Can you please tell me a little bit more about it?
Thank you very much for this question. This program is also for all caregivers, not only nurses, because I am doing my PhD at psychiatric nursing, and because my background at all cancer nursing, I choose to work with cancer nurses, and because I know from my own experience, especially because like Maria and I had also some challenges, and I need to cope with these problems actually. So I know they need to improve their resilience. I work with cancer nurses, but this program is for all caregivers.
Thank you so much. While we don't have any more questions, I will ask you another one. So last week we were talking about burnout, and a colleague of ours in my hospital said something that burnout is a problem of passion. When you care, when you are extremely committed, and with expectations also, as you talked about it. So and we are seeing after COVID in the last few years, a lot of nurses, oncology nurses, are leaving the profession. So we will have a future problem with this, and it's more than just lack of human resources. It's this kind of burnout. It's this kind of lack of training, of individual training. And you talked about putting the oxygen mask first. And the question I have to you is, and I'm a nurse manager, I'm managing a team, how can managers also support nurses that struggle to do it individually?
This is really important and good question. Thank you very much. Because as we are cancer nurses, while we are working, we need something from our nurse managers to see, to support. So nurse managers have a key role to follow and evaluate the staff nurses in terms of compassion fatigue symptoms, for example, or burnout symptoms. Also creating a culture preventing compassion fatigue. They should support their teams, open a free time maybe to share their experiences, listen them, and use therapeutic communication skills. They may give positive feedback when they have a success, for example. They have really important roles to support staff nurses actually, and to follow, evaluate them.
And do you think it's possible in a day-to-day clinic practice, like doing a debriefing for your experience? For how long does it take to actually be able to?
Of course, it is not easy. I also work with nurse managers, for example, for this program. And because of actually from the previous program, cancer nurses told me expected to teach this program to their nurse managers actually. And then I conducted this program with them. Of course, they have some struggle to reach many things, to manage or related patients, staffs, but they may, I think it is not easy, but it is of course possible. For example, for me, we have a meeting once a month daily meeting. We are sharing our experiences, or it was a training session. Maybe at this meeting, nurse managers may conduct a session to debrief. For example, other important or difficult subject, for example, death. That can be talked at this meeting, how it is going, how they are feeling, are they able to cope her or his feeling when they lost their patient. So it is possible, not easy, but this regular meeting can be an example to discuss, to share their experiences.
So it can't be like an everyday thing, but could have a meeting, a regular meeting, like monthly meeting. You think it would help the team, right?
Yes, monthly meeting can be chance, but also nurse managers are really know their nurses. They need to constantly watch their staff in terms of symptoms, burnout, compassion fatigue. They are able to evaluate actually, but they only need to know they will able to do this because they are actually doing this. They are regularly communicating with nurses. How is it going, or do you need anything? So maybe we need to increase self-awareness about these concepts and what should be.
Yeah, definitely.
Mhm.
Thank you so much, Tugba. I think your presentation matched perfectly with Maria's presentation, more on individual level, and yours more in a more structural and interdisciplinary ways. I think it was two perfect conversations that are accordingly to the Nurture project of the EONS. Basically giving awareness and reskilling nurses like we individually in our workplaces to be able to be more resilient to everyday work life that in oncology, as we know, is very, very, very demanding. Thank you so much to both. And I don't know if Greg wants to say something more. And I know that Dimitris wants to speak a little bit also, and Irati. So I think that they can intervene now. Thank you so much to both of you.
Hi, and thank you, everyone. Dimitris and myself, as the co-chairs of the Early Career Nurses Working Group, we are so grateful for everyone who has participated in this webinar series of 2024. So we want to thank all of the speakers for your invaluable contributions. All the presentations have been really interesting for early career nurses, but I think for nurses in oncology and cancer nurses in general. So thank you so much, and thank you for your time. And then also for all the hosts, everyone who has helped us, prepare, plan for these webinars, as well as for Corinne, who's supporting us with IT. So thank you, because each and every one of you has played a big role into making this happen, as well as for all the participants who have joined us on usually your free time, your spare time. So we just hope that these webinars were useful, that you've learned something, and we are very happy to have been able to offer this for you. Welcome next year again with new topics for early career nurses. So if you have any suggestions, topics, we're open for that. And now I'll also let Dimitris talk and say thank you to you all, but we are very grateful.
Yeah, from my part also, I would like to thank you all the speakers, moderators, the participants. This year we made it because of you. We faced some challenges, but yes, we had our 3 webinars, and this year we had the opportunity to learn and to discuss about the bone marrow transplantation at the first webinar. And then the second webinar provided the essential skills for early career nurses in scientific writing and result dissemination. And today we had the opportunity to hear about what does it mean to be a cancer nurse, what are some self-care tips and strategies, and ways to build a resilient cancer care team. So all the three webinars gave the chance to the participants to reflect on their own experience in cancer nursing and to discuss their experience with the experts. So as N.U.R.T.U.R.E said, EONS Early Career Nurses Working Group will continue to act as a safe space for young and early career cancer nurses, and we hope to see you again in our future activities. Thank you very much, all of you.